After months of negotiations, Senate Republicans are finally gearing up for a vote on the president's so-called Big Beautiful Bill. Republican leader John Thune has predicted the Senate could begin consideration of Trump's sweeping domestic policy bill as early as the middle of next week. It's a tight window to get the negotiations buttoned up and the bill ready for the Senate floor. Joining me right now is former Interior Secretary and Democratic New Mexico Congresswoman Deb Haaland. She's also running for governor of New Mexico. Secretary, great to see you.
Nice to see you.
So one of the issues that Senate Republicans still need to work out in the bill is in regards to Medicaid. A number of them have made clear that they could vote against the Senate bill if there aren't provisions to ensure rural hospitals are protected from some of the changes to Medicaid in the bill. You say this is a catastrophe waiting to happen. Why?
Indeed it is. It could close 15 rural hospitals right here in New Mexico. And if anyone's been here, they know that New Mexico is largely a rural state. We have like 3 fairly large cities. Everyone lives, most of our populations are in these rural communities. If these hospitals close, they have to drive hundreds of miles to get the health care they need. And I think that would be a really devastating effect of this terrible bill that we hope doesn't pass.
That number is significant, and put it another way, the Centers for Medicare and Medicaid Services says 32% of people in your state are enrolled in Medicaid. And a group of Republican holdouts is saying they, too, are very concerned about this, led by Senator Susan Collins of Maine. They're pushing leadership to create a kind of stabilization fund that states could use. In your view, would that be an answer? Would that help?
So, yanking Medicaid away from folks who are already, struggling to make ends meet, it's just, it's salt on the wound. And I think we have to protect Medicaid in every possible way. I wish that folks in the White House would kind of see that, they don't understand how most people live. And here in my state of New Mexico, people struggling to make ends meet, the last thing they need is to have their health care yanked away from them. Add on top of that the fact that the White House has fired, thousands of workers from the Veterans Administration. We are facing, budget cuts and program cuts, and folks being fired right and left. It has had a really devastating effect on New Mexico. And this bill would really devastate so many communities across my state.